Let me ask you something. What if I told you that there is a cancer that almost always gives a warning sign before it became advanced, and that there is a test that can detect this cancer? Would you have that test done? Because in all honesty, that cancer does exist, and it's called colon cancer. Today, in the month of March, I'm going to be giving you a full breakdown of the warning signs, the risk factor, who needs to be screened, when to be screened, and screening options, because it's completely heartbreaking to find people learning that they have colon cancer late when it could have been caught early. Colon cancer, which is technically colorectal cancer, is the second leading cause of cancer death here in the United States of America. The American Cancer Society had actually estimated over 53,000 colon cancer deaths in 2024 alone. And the alarming part is that the incidence in people younger than 55 years has been rising by 1 to 2% since the mid-90s. So it's no longer a disease of older individuals. As a matter of fact, it's the leading cause of cancer deaths in men younger than 50 years and the second leading cause of cancer deaths in women less than 50 years. And if you're wondering why this is going on, there is really no clear answer for now. A couple of things have been studied, like obesity, sedentary lifestyle, our consumption of, ultra-processed foods, and changes in our gut microbiome. But again, the bottom line of this is that if you're in your 30s or in your 40s and you think this has no business to do with you, then I want to let you know today that the data disagrees with you. I'm going to tell you what makes colon cancer different from every other kind of cancer. With colon cancer, there is usually a long intervenable period before it becomes invasive. And this intervenable period usually starts as a small polyp, which is an abnormal growth in the lining of the colon. And most of these small polyps are benign, but some of them, like the adenomatous polyps, can change and transform over time and become cancerous. Again, this long intervenable period in which the adenoma grows to become cancerous takes about 10 to 15 years. So we have a massive window where screening can actually be done. And then if you do a screening and it is found and taken off, end of story. But if you do not do a screening, you do not know that you have a polyp, nothing is done, you get into a different conversation. And this is why colon cancer is described as preventable, not just treatable, but preventable in a way that most cancers are not. I'm going to spend a little bit of time talking about some of the warning signs that you can get, because that's one of the things most people need to look out for. Colon cancer does not usually come with symptoms, especially in the early form. It's usually very silent. But when symptoms show up, these are some of the things that you can look out for. I'm going to start with the big one, which is blood in stool. It can be bright red blood. It can come out as dark stool. It can come out as tarry colored. It can come out as maroon colored. Some people would mistake a rectal bleeding from hemorrhoids. Hemorrhoid bleeding is usually very common. But when you're having a rectal bleeding, this should be evaluated. As a matter of fact, once you're over the age of 45 and you are having blood in your stool, just call your doctor and get it evaluated. Next, I'm going to talk about is persistent change in your bowel habits. I'm talking about going from constipation to diarrhea. If it's going on for a couple of weeks or for weeks unchanged, then you have to get it evaluated. Not only in the bowel pattern or the habit, you also have to check the consistency of your stool. Stool that has been semi-solid, becoming hard, pellet-like. You have to get it evaluated by your primary care provider. There is also the sense of incomplete voiding. You have gone to move bowel, but you feel like it's not complete. There is something still left there. It could signify that you have a mass in your rectum. You need to get it evaluated. Another sign to also watch out for is unintentional weight loss. You are not trying to lose weight. You have not changed your eating habits. You have not changed your eating pattern, but you notice that you are losing weight. That's a red flag and has to be evaluated. Another sign is abdominal pain or cramping or even bloating that will not go away, lasting for weeks. It could be a sign of colon cancer. Another sign to also look out for is fatigue, tiredness, and anemia. Colon cancers, especially the ones on the right, can bleed for a long time and slowly, and patients would usually present with iron deficiency anemia. And sometimes it's usually the first thing that is found on the labs before even any GI or gastrointestinal symptoms appear. So if your doctor says that you're anemic and there is no clear, cause of your anemia, and you're above the age of 45, above the age of 50, colon cancer should be the first to be suspected. Now, note, before I go ahead to talk about risk factors, I am not trying to scare anybody here, because most rectal bleeding could just be hemorrhoids. Sometimes it could just be irritable bowel syndrome or even your diet. But these are the reasons why we screen. And these should also be the reasons why you should not wait. Onto risk factors. I'm going to divide this into 3 categories: the modifiable risk factors, the non-modifiable risk factors, and then genetics. Onto modifiable risk factors. These will include diets that are high in red meat or processed meat, alcohol, smoking, sedentary lifestyle, obesity, and even low fiber diets. Now, these risk factors are not just risk factors in the abstracts. They are actually actionable risk factors. So for people who are already at an increased risk, addressing these will really matter. Onto the non-modifiable risk factors. The first one is getting older. There is nothing we can do about that. But getting to the age of 45, the risk of colon cancer rises very sharply, and it continues to rise with each decade. The second is personal history of colorectal cancer or an advanced polyp. If you've had it before, then you have to be under surveillance because it can come again. The third non-modifiable risk factor is having a personal risk factor of inflammatory bowel disease like Crohn's disease or ulcerative colitis. This already puts you at a higher risk than the population of having a colorectal cancer. Usually your gastroenterologist already has you under surveillance, and then you have to do your routine colonoscopy. And the last non-modifiable risk factor I'll be talking about is having a family history of colorectal cancer or an advanced polyp, especially if the first degree relative had it before the age of 60. For this, your screening will start earlier, usually at age 40 instead of 45 for the average risk population. You also start at age 40 or 10 years earlier before your first degree relative was diagnosed with the colon cancer or the advanced polyp. Whichever one comes first is what we'll go by. And the last group of risk factors I'll be talking about is the genetic syndromes. I'm talking about Lynch syndrome, also called the hereditary non-polyposis colorectal cancer. It's the most common hereditary colorectal cancer, and it actually accounts for 2 to 3% of all colorectal cancers. The second group will be the familial adenomatous polyposis. This syndrome is actually less common than the Lynch syndrome, but it can cause a lot of polyps, hundreds of polyps, and it has near 100% risk of colorectal cancer development if left untreated. Now, there is something I want to address very directly. Black Americans have both the highest incidence and the highest mortality rate from colon cancer when compared to any other racial or ethnic group here in the United States. The data from the American Cancer Society had shown that Black Americans are significantly more likely to develop colon cancer and significantly more likely to die from it than the white Americans. And a meaningful portion of that gap is driven by the later diagnosis and not just the biology. Studies also found that Black Americans tend to present at younger ages. The median age of diagnosis in a black man found to be around 63 years, while in a white American was 66 years. And this is part of the reason why some experts are arguing that for the black community, colorectal screening should start at age 40. But if you have any additional risk factors, I believe this is worth discussing with your primary care provider. This brings us to the screening guidelines. And I'm going to give you the current landscape. Both the USPSTF and the American Cancer Society both recommend that individuals who are at average risk of developing colon cancer should start their screening at age 45, no longer 50. And that changed in 2018 for the American Cancer Society and in 2021 for the USPSTF. And it was because of the rising incidence of colorectal cancer in people who were younger. So, if you're between the ages of 45 to 75 years old and you have not been screened, this is a conversation you're supposed to be having with your primary care provider. Screening is usually stopped after the age of 75. From 75 to 85, screening is usually individualized. And this depends on your prior screening history, your overall health, and your life expectancy. If you're greater than 85 years old, screening is usually not recommended. Let's talk about the screening options that there are. And I'm going to start with the gold standard, which is the colonoscopy. This test is usually diagnostic and therapeutic, meaning you can use it to treat and you can also use it to diagnose. Usually, for a colonoscopy to be done, you need a bowel prop, which is usually done a day before the colonoscopy. It's done under sedation, and if it is clean, you don't have it repeated until after 10 years. If they go in and there is a polyp, the polyp is taken out. That's why I say it's therapeutic. If there is a colon cancer, then they will find it. If there is a positive and any other screening options that I'm going to be talking about, you have to come and get a colonoscopy done. Another screening option that we have is the fecal immunochemical test. This is done at home. It's a stool test. With this test, there are antibodies that are used to detect blood in your stool. This test is usually done every year. It is highly accessible. But like I said, if you have a positive test on feet, you have to go have a colonoscopy done. It's a very good option for people who have access barriers to having colonoscopy in the first place. Another screening technique, the Cologuard. This is checking stool DNA with the fecal immunochemical test. That's the FIT that I talked about. It checks for abnormal DNA from cancerous cells or even precancerous cells or even blood in the stool. It's also done at home. For this test, it's done every 3 years. And it's more sensitive than the FIT. Again, you have a positive Cologuard. Like I said, with a positive FIT test, you proceed to get a colonoscopy for confirmation. CT colonography. This test is called the virtual colonoscopy. You still have to get a bowel prep done, like when preparing to get a colonoscopy, but you do not need sedation. This test is only diagnostic. It's not therapeutic, meaning they go in, if they find a polyp, then you still have to go and get a colonoscopy done. If you do a CT colonography, the next time you have to repeat it is in 5 years' time. So it's done every 5 years. Lastly is the flexible sigmoidoscopy. This method of screening for colon cancer only looks at the lower part of your colon. It's done every 5 years or every year if you have it done with an annual FIT. It's actually less commonly used these days. So choosing what colon cancer screening you need depends on patient preference. And in all honesty, and I like always say that the best test is the test that you actually do. So it's better if you're getting the FIT test every year than that you're deferring to get a colonoscopy, which is the gold standard. So feel free to talk to your doctor about the cost, the access, insurance coverage, and whatever makes sense for your life. For those watching from Nigeria or elsewhere in West Africa, I want you to know that colon cancer is not just a disease for Western countries. With increasing westernized diets and sedentary lifestyle, global data has shown that the incidence of colon cancer is also on the rise. I know that screening infrastructure varies widely, but you see awareness of warning signs, that's universal. If you have persistent rectal bleeding, unexplained weight loss, or a family history, then this conversation about colon cancer screening is worth having with your primary care provider, regardless of where you live.